Welcome to Walk with the Doc, December 12th, 2018. The great topic today, we have Dr. Hannah Doe, who is one of the new GI specialists at Doylestown Health. So please welcome Dr. Hannah Doe.
Well, hello everyone. My name is Hannah Doe. I'm one of the gastroenterologists here. I grew up in Harrisburg, so not quite local to this area, but in Pennsylvania. I went to medical school at Jefferson. Really enjoyed my time in Philadelphia, but kind of wanted to get a new, a new area. Went up to Connecticut and lived in New Haven for 3 years and did my GI fellowship up there. I did my residency up there. It was very, very cold. I had a lot of snow, and then when I got an opportunity to go out to sunny LA for fellowship, I certainly said yes. So I was out at University of Southern California, Trojans, if you guys follow college ball, for fellowship. But really all my family was from here, so we decided to come back. I worked for a few years at a cancer center, so saw plenty of cancer in my time there, and then came up here to Doylestown. I started here in October 1st and have been really enjoying it. I work with a large group. There's 7 gastroenterologists here in Doylestown. We're at the Pavilion, and I really wanted to thank Dr. Comezzo for reaching out to me and asking me to come and talk to y'all today, because colon cancer is one of those things that I feel is completely preventable, and I think that the more people are aware of it, the better we're off. So I kind of did a quick count of the audience here, and we have probably at least 30 people. So statistics say that actually 1 in 25 men or women will actually develop colon cancer in their lifetime. So with this group here, with that statistic, at least one person here would develop that. And that's a really sobering statistic, because if you think about it, it is pretty frequent, okay? When it does happen, it's actually the 3rd leading cause of cancer death. Now, colon cancer, I'm really happy to be in my line of work because it's one of the few cancers that are completely preventable. So in America, in the United States Preventive Task Force, one of the big reasons why we develop colon cancer is that they start out as polyps. And I actually have a handout here, and I haven't passed it out because I don't know who wants to actually be carrying something while they walk. But it has a really nice schematic of how colon cancer develops. What I usually describe to my patients is that they start as little polyps. And what are polyps? They're really nothing except for warts. So they're kind of like skin warty growths that start inside your colon. You can't really see it with the naked eye, and unfortunately it causes pretty much no symptoms when they're small. So usually people are not going to have bleeding or pain or discomfort or anything of that nature. And the problem is that we understand that if they're left over time, they start out small, but they actually grow large, and to the point where sometimes they can actually cause a blockage if it becomes cancerous, or even grow deep enough that it can travel to lymph nodes and go to other areas within the body. Unfortunately, we don't want to wait until it becomes that point. That's when people can have bleeding, they can have pain, they can have a lot of discomfort. So the hope is that we catch them while they're in the early phase, which is when they're just small warty growths. There's a lot of different ways in which we can catch polyps. The number one, probably gold standard, is colonoscopy, as I'm sure you're aware. We usually recommend a colonoscopy starting at the age of 50. That might change. As of this year, the American Cancer Society is talking about starting to screen people at 45, because there is a lot of data that people in America are growing polyps at a younger and younger age. Now, the colonoscopy is a great procedure because it allows for doctors to detect both the polyps and also to remove it at the same time. And we do know that cancers start out as a polyp. So if you remove them, it really slows down that process and prevents that wart or polyp from ever growing to become a large tumor. Now, a lot of people might be ambivalent about a colonoscopy because, in order to do one effectively, you have to do the cleanse, okay? That's the unfortunate part, because right now, what is in our colons? It's poop, it's stool. So, you can't really get away with doing a CAT scan or an MRI, because it's very difficult to tell, is this a ball of poop or is this a polyp or a tumor? So you have to do that cleanse. And I always say, get that cleanse in. That can sometimes give you a little relief. It's not as bad as it once was. So most people who've had this many years ago might say that, it was a big gallon of milk or a jug. We actually have a lot of smaller preps now that are about 8 ounces big. So they're pretty darn small. They still taste yucky, I won't lie to you. But if you refrigerate them or add apple juice or Gatorade. They're a little bit more palatable. Now, if a colonoscopy is not for you, and I understand that, there's a myriad of other testing modalities where we can check your stool for microscopic blood. There's things like a fecal occult blood test, and there's actually a newer one called a Cologuard. So I don't want you to be scared of a colonoscopy. So when we talk about colon cancer screening, it can involve a myriad of other diagnostic testing that's less invasive. So I do encourage you to talk to your primary care doctors or if you have a gastroenterologist about this, okay? But in general, there is literature that show for every polyp that you remove, you improve a person's lifespan. So meaning it actually saves lives. So every polyp that you remove, that person ends up living longer. Okay, I'm going to leave this information here at the table, or I'm happy to pass it around. It does have our business card here. There's 7 gastroenterologists, and I also highlighted my name, so if you guys have any questions, feel free to reach out to me. Does anybody have any questions right now?
What's new in preparation?
Well, probably the newest prep right now is called Clenpick. It's a 5-ounce bottle. I have tasted it myself. It tastes like a Dimetap. So it's a little sweet. It is covered on most commercial insurance. We do have a coupon card that will take the copay down to $40. The only problem is if you're Medicare, I don't know if it's covered. But that is the newest prep. It's the lowest prep and probably the best tasting prep.
They say in men after age 80, colonoscopy is no longer needed. Is that true, and if so, why?
So that varies. So the guidelines say that if you hit the age of 75 or older, you can consider whether or not it's worth it to have a colonoscopy. So what I usually turn around is I ask my patient, how long do you think, are you going to live to 110 or 100? If you're out there exercising, doing walks like this, and you don't have medical problems, I don't see any, and you're very healthy, I don't see a problem with continuing to do colon cancer screening even at the age of 80. Now, it's a different story if you're 80 and you have like a lot of medical problems, you're living at home or at a nursing facility, then I would say that's probably not the best thing to do at that time. So it depends on what kind of 80 you are. So, I don't know if that makes sense, but if you're a very healthy 80-year-old and you intend to live to 110 or 100, I don't.
He's the new 70.
Yeah, and and it just kind of really depends on your health. But if you have a lot of medical problems and you've been in and out of the hospital a lot, it's probably not a good idea. Yeah. Oh,
He's fine.
There, if you have an ostomy, it means portion of your colon was removed, and the colon is necessary to kind of reabsorb water. So diarrhea is very common. There are certain medications we can give to help kind of do that. I also sometimes connect you with our nutritionist. We do have 1 or 2 that come to the office, and they can kind of augment what you're eating, and that can actually help it.
Takeout.
Yeah.
Not
Yeah. So high fatty foods, that's going to be difficult to digest and get, like take out.
He knows.
Sigmoidoscope, would that be an option as you're getting older instead?
Yes.
Everybody still do those?
Yes, we still do them. The reason that it's I'm apprehensive about recommending a sigmoidoscopy, it is still in the guidelines, and that you would have to do every 3 years. Whereas if a colonoscopy is normal, you're good for 10. The reason with a sigmoidoscopy is it only looks on the left side of your colon, and we found out there's a lot of new data about a special kind of polyp. It's called sessile serrated polyps, and they tend to grow on the right side. So with that information, technically in the guidelines, it's still okay to do. But in my opinion, if you're going to be put to sleep and you're going to have sedation and somebody has to come and pick you up and drive you there, you might as well have the full colonoscopy at that point. And you still do have to do a prep. You don't have to drink everything, but you still have to give yourself enemas. So my experience, like if you were my sister or my mother, probably the colonoscopy is a better option. Yeah. Yes.
Those polyps are removed, do they grow back again?
I do say, people do ask me why they grow polyps. We don't know. There's a component of genetics and maybe the types of food that you're eating. It is associated with red, barbecued, like charred meat. But most of the time, if I remove a polyp, it won't grow back in that same location. But if you do have polyps, you're likely to grow polyps again. Yes. All right.
I know someone who had what was called a virtual colonoscopy.
Yes. Yes.
What is it and how effective is it?
That is a very smart question. So a virtual colonoscopy means you have to do the entire prep. So you still have to drink everything, clean yourself out, and then they flood you with contrast. You drink a lot of contrast, and then they take a picture as it's going through. So it is like a CAT scan, but those scans are really good for large polyps. Okay, they're not very good for very, very small polyp, but that is an alternative for people who can't get a colonoscopy, like, you know, who have, they're on blood thinners, or there's a lot of medical contraindication for them to drink the prep, like heart failure or things like that. So it is a good option for somebody who can't get a colonoscopy, but usually it picks up larger polyps. Yep.
Thank you.
And final question. Is there any good, real, solid data that walking and exercise will help reduce any risk of colon cancer or anything like that you've seen?
You know, there is a lot of data for certain supplementations. They talk about calcium. They talk about a low red meat diet. They talk about avoiding smoked meats like salami, prosciutto. The smoked meats are carcinogenic. And there is some data that if you're thinner, you develop less polyps. So certainly diet and exercise can't hurt, but I haven't seen any like direct data with that
More
correlation.
lifestyle change that you shouldn't.
Yeah, but I would imagine anybody who's active would be more fit and less obese, so that would make sense.
Very good.
Okay, all
All right.
Quick, what about celiac disease? Have you noticed any data with someone with celiac that has maybe a higher percentage rate?
You know, I am not aware. I know sometimes people with celiac disease can grow polyps or obviously develop lymphoma within the small bowel tract, but I haven't seen any data that said that if you have celiac, you're more likely to develop colon cancer. Yeah, celiac's associated with other things like diabetes and, you know, but not as far as I'm aware with a higher rate of colon cancer.
All right. Thank you so very
Yeah,
much.
thank you guys. I'm going to leave this over here, okay?